having that knowledge that if I use these over-the-counter medications or triptan medications too frequently can actually worsen my underlying disease. If you have that knowledge, when you start noticing that you're having to use those options more than twice a week, have that proactive conversation with your healthcare provider that I need to figure out other ways at addressing my headache exacerbations. Help me. What are the options that I have?
I know that we've had many people in our community who've had a doctor say bluntly that they have to cut back, and who just doesn't appreciate that we were following instructions that we thought were fine. And sometimes we're not even told what the limits are on the treatments that we're given. And at that level, it's almost like blaming with this lack of understanding that can occur. But the conversation can't stop there. As an empowered patient, we have the right to step in and say, okay, I hear you with the limit. Or if required, I hear you with the entire removal of the offending medication. But then what else can we do to address the attacks that I can't treat with this medication? What preventives should be considered? Are there biobehavioral options, devices, and so on?
Exactly. And I actually encourage my patients to not focus on the removal of the use of those treatment options. I don't actually give my patients like a tapering schedule or this is when things need to be stopped. I give them the education and the scientific knowledge that it can potentially contribute to worsening of the underlying disease process. Then I give them preventive treatment regimens that we know is going to eventually reduce the use of those medications because it's going to reduce the pain and disability from migraine. And then I give them other options they can use. So that's the knowledge and then other options. And we focus on the other options. And over time, without fail, patients are able to reduce the use of those medications. They don't want to use those medications. And if you give them other options, they will go towards those other options.